Hello friends, in this video I am going to discuss fundamentals of depression. Depression is the term that is used much frequently by most of the people. Any sort of sadness, whether it is temporal, circumstantial, or even because of some physical problem, people name it depression. But depression is something serious. It is comparatively enduring that persists for days, weeks, or even months and years. So in this video, I will discuss the fundamental meaning of depression. Let's start with the first question, that is, what is depression? Technically, depression is a mood disorder under which people feel dullness, inactive, sadness, hopelessness, not able to concentrate, etc. So, depression influences the bodily energy, or better to say, it chokes the physical energy that ultimately reduces the physical activity. In addition to this, it also influences the mental process and functioning, and as result of this, people feel dull, sad, anxious, hopelessness, helplessness, etc. Now, the next question you may want to know is, what are the types of depression? Technically or clinically, there are different types of depression, such as major depression, persistent depressive disorder, perinatal depression, etc. But in a common language, there are two categories of depression, namely simple depression and clinical depression. Let's discuss each of them in brief. Simple depression. It is the most common type of depression, which is temporal and circumstantial in nature. Over a period of time, there are chances it gets corrected without any medicine or psychologist's counseling. Almost every one of us at some point in time feel depressed because of any reason, such as failing in the exam, loss of job or insecure job, financial stringency, if someone dies, etc. But over a period of time, such depression disappears spontaneously, so nothing need to worry about. Next, that is clinical depression. If the causes of depression persist, then the simple depression transforms. Next, clinical depression. That is, if the causes of simple depression persist, then the simple depression transforms into clinical depression. In addition to this, there could be many other reasons of clinical depression, such as major trauma, if loved one lost, etc. Note: normally, clinical depression is a medical disorder and it needs proper medical treatment to get rid of. Now, the next question is, what are the causes of depression? Or why people get depressed? Well, by the time it is not exactly discovered the ultimate cause of depression. However, as researchers concluded, depression most likely is the result of a combination of genetic, brain biology, environmental, and psychological factors. Depression can also occur because of some serious illness such as cancer, diabetes, heart disease, and Parkinson's disease. And depression may also occur because side effects of some medicines. Now, the next question is, who are the victims or most vulnerable of depression? There is as such no criteria. A person of any sex and age can get affected, such as men, women, old age people, and even children. Now, the next question is, how to treat depression? As discussed above, in normal circumstances, depression doesn't need any sort of special treatment. But in case it persists for a long time, then it needs medical treatment. Following are the major ways of treatment. Medication. There are certain antidepressant medicinal pills that give relief. But if it doesn't get treated with such medicines, then one needs psychotherapy. Such therapy effectively treats the issue of depression.